Malaria, being a very common disease, is interestingly preventable. Malaria is a disease that we commonly face in our hospital settings. It is caused by various parasites. The commonest is Plasmodium falciparum, which usually causes severe malaria. It is also caused by other parasites such as Plasmodium vivax, Plasmodium ovale, and malaria. However, these are not common and they usually don't cause severe malaria. In our setting, malaria usually presents with various symptoms. Commonest is usually fevers, which can be very high grade, but it also comes with other symptoms such as headache, chills, body aches, nausea, vomiting, diarrhea, passage of bladder urine, and many others. Malaria itself is quite common. However, whenever we get these symptoms, they might also mean other diseases. So the best approach is usually to seek medical care. Whenever malaria is suspected, depending on the age group or the category of the person, whether they are children, adults, or pregnant women, some tests will be very important. The commonest test we start with are the specific malaria tests, which we could do as a malaria rapid diagnostic test. In this case, the blood is placed on a device that quickly gives results within 15 to 20 minutes. Another test that we could use is a blood slide for malaria. Usually this is done by an experienced technician in a lab who puts blood on a slide and looks at it under a microscope. And if the parasites are seen, they will be declared and even the quantity given. Sometimes these tests can be negative early on and might be repeated later, as the doctor suggests. We also do other tests to look at the severity of the disease, but also the complications it might have caused. So your doctor might request for a complete blood test to look at the changes in cells, the level of the blood, such as anemia, but also platelets, because malaria tends to cause a reduction in platelets, which we call thrombocytopenia. The doctor might also request for a liver test. This usually helps tell us if the liver is affected. Many times the liver enzymes might change a bit, especially in severe malaria. It also measures the level of a chemical called bilirubin, in which case it might tell us a complication about malaria. Another test the doctor might request for is a kidney function test or a renal function test, because malaria sometimes might cause acute kidney injury. Doctors will do many other tests to confirm the severity of malaria or to rule out other diseases that present like malaria. These include a CRP and many other inflammatory tests such as blood cultures and so forth. In terms of approach, once malaria is diagnosed or confirmed, the doctor will categorize it as to whether it is uncomplicated or complicated stroke severe malaria. When it's uncomplicated malaria, depending on whether it's a child or a pregnant woman or an adult, the doctor might recommend oral medications. Usually in our setting, drugs such as Coartem, Deocortexin, and several other brands. These are usually taken over a period of 3 days for the treatment of uncomplicated malaria, and they can be taken at home without need for hospital stay. When it is complicated malaria, many times this depends on the complication. The doctor might advise on hospital admission or treatment with injectable medications given through the vein. So the patient will be given either a cannula or a line that will allow the doctor to administer those medications and others. Usually it is given over a period of 24 hours according to the weight and usually the doctors will monitor to see if the patient has cleared the malaria parasites. After the intravenous treatment, the patient might still be put on oral medications to complete the dose in hospital or at home. Other complications are usually treated alongside. When the patient is dehydrated, IV fluids shall be given. If the patient has any other infections, such as bacterial infections that might come alongside malaria, antibiotics might be given for those other complications. Sometimes patients get malaria with severe complications such as coma, convulsions. Sometimes malaria affects the respiratory system, in which case we get edema of the lungs, which is water in the lungs, or any other changes such as acidosis, where there is a buildup of acid in the blood. The doctor might advise you to get admitted into a critical care unit so that treatment specifically for those is done. This might require things such as dialysis when people have acute kidney injury and the kidney needs support. Sometimes if we have pulmonary edema or acidosis, some patients might require support with ventilation and other treatments to reverse such complications. There are special people or categories for whom we look out, especially for malaria. These are, one of them are children. Children tend to get severe malaria, which might progress quickly, so usually pediatricians or the doctors seeing them will take extra attention in rapid diagnosis and treatment. Pregnant women are also vulnerable groups of patients. Usually their doctors or the obstetricians advise them to quickly seek medical help. The special thing about pregnant women is that malaria can affect both the mother but also the child. It might result in effects on the child such as poor growth, but also can result in miscarriages and eventually death. So these ones are usually advised to seek quick medical care, and they're usually assessed by the doctors and given appropriate treatments. In pregnancy, usually the drugs have to be safe, so most of the drugs given in pregnancy will be specifically safe for the fetus at any stage. Malaria is interestingly preventable. So apart from a mosquito net, which protects you from bites at night, you can attack the mosquitoes and either eliminate such areas where the mosquitoes hide, or in some places people are able to spray. There are other ways of prevention, including insect repellents, the type of clothing you might wear in the night if we wear clothes that cover most of the body. Prevention might also involve treatment for certain people. So there are people who are given malaria prevention, especially when the infection frequency is high. Special categories include pregnant women who will be given medicine according to the obstetrician or the doctor seeing them. The prevention might be given in the second trimester or in the third trimester, which are the second and third stages of a normal pregnancy, to prevent malaria. In certain categories, even certain children or individuals with low immunity, such as people with diabetes or on cancer treatment or with diseases that reduce immunity like HIV, the doctor might judge that treatment can prevent malaria, and you will be assessed and given appropriate treatments. The World Health Organization has licensed vaccination specifically for malaria. The vaccine is being rolled out in various centers, including private facilities. The current rollout is targeting especially children, who are the most vulnerable group. This is a vaccine that has been tested and proven safe, and given that malaria causes a lot of morbidity and a lot of mortality, we encourage people to positively receive the vaccine and go ahead and have it administered.